So after ACL surgery, one thing you're going to have to do is reteach yourself how to jump and land with the correct technique. Now I know many of you might be saying jumping and landing, I've been doing it my whole life. It's like riding a bike, I know how to do it. Once I get back into it, it'll just come back naturally, okay? And that's not the case. A lot of people have issues with regards to technique after ACL surgery, and those issues can actually lead them to have an increased chance of re-tearing their ACL again or tearing the ACL on other knee. So this is something you definitely want to go over and learn. Okay. So first we'll just talk about the landing technique, and I put just a little sleeve on my right knee there, so I'll pretend that's my surgical leg, and you can just focus on that. Okay. So landing technique, which you'll see, is a few different things that people would do after surgery. So the first one is they'll land on their good leg more so than being evenly distributed. So they'll land and they'll shift their weight onto their good leg, right, like that. Okay. And we don't want that. That puts more stress on the other leg. Okay. So that's one common thing you see after ACL surgery with regards to landing. Another one we'll see is the knees go in like they're almost kissing each other, okay? And what you'll often see is the leg that had surgery on goes in more than the other leg, okay? But sometimes you'll see an equal dip in like that, okay? And that's a really bad position to be in, okay? We call this dynamic valgus position. When you're in that position, it just opens up the door for more knee injury to happen. So another one we also see is when you land very upright, very stiff. Okay, so the knees they land very straight. Okay, instead of nice bend, nice soft give to them, they'll land very stiff and hard. Okay, and that puts a lot more stress through your legs. Okay, when you land soft and flex your knees and your hip, it absorbs a lot of the impact. So what I tell my patients when they learn how to drop down again and land is, one, to try to land like a ninja. Try to land very quietly. Okay? So you, and you want to get good knee flexion, like this, good hip flexion. Okay? You want to absorb that impact, and then you're in a ready position to do something else. And so those are the three things we see that are commonly wrong when you're landing. And that was the correct way to land. Again, nice and soft, good hip flexion, good knee flexion. Now, if you take those same concepts, okay, and you can apply them to jumping. So what you'll see a lot of people do when they jump is when they load up, first of all, they'll kind of do that dynamic knee valgus thing where the knees kind of kiss together. We don't want that. If they don't do it on their non-surgical leg, you might see it on the one they had surgery on. And again, we want to avoid that position. That's a really bad position for your knees. So when you load up, you want your knees to be straight or even a little bit out, okay, not in. And the other thing you want to do is you want to load up evenly. You'll see a lot of people load up more to their side that they didn't have surgery on, okay? So you want even loading, knees don't go in, okay? And then you also want that good knee and hip flexion, okay? You don't want to load up with just bending your hips or just really shallow. You want to load up, get a good bend in your knees and your hips, okay, and then you can explode up like that. So make sure you learn how to properly land and jump, because it will have long-term implications. It will make you perform better, it will decrease your chance for future injury. Just overall, it's good for your knee health.